Hello friends, once again with you in a part of osteology. We are moving toward the thorax in different colleges. So I am going to discuss about the generalized feature of vertebrae. Actually, vertebrae are small pieces like this. Vertebrae are small pieces which are adjusted one about the other or one below the other. Okay, and forming a column that is known as vertebral column. The individual vertebra, there are the 33 in numbers, 7 in cervical region, and that is a characteristic feature for mammals that vertebra are 7 in number, whether it's a vertebra of camel, cervical vertebra of a camel, or a lizard. The human being. The cervical region, length of the cervical region does not varies due to the number. This is due to the shape and length of the vertebra, and 7 cervical vertebra line in a mammals, usually the mammals. Okay, then 12 thoracic vertebra which are interlinked in such a way that the viscera are not protruding. Okay, then there is 5 lumbar vertebrae, 7 cervical, 12 thoracic, 19, plus 5 lumbar heavy vertebrae, that is 24. Then 5 sacral vertebrae which are fused with each other and forming a single bone that is known as sacrum. This is the sacrum, and you can see, assume the different vertebra are fused in this one. 5, 24 plus 5, 29, and 4 coccyx vertebra fused to form a single piece of coccyx, so that we can assume that fused vertebra are sacrum and coccyx. If we have different type of vertebra on examination table, an examiner is asking, identify the vertebra. Don't get nervous, because individual vertebra, whether it belongs to the cervical region or it belongs to the thoracic region or lumbar region, because the sacrum is a single piece of bone with a fused 5 vertebrae, and similarly coccyx, and usually they are not asked as the individual vertebrae. Now, the different region vertebra having different features, as intervertebral foramen through the lateral mass of this intervertebral foramen passes through the lateral mass of the vertebrae that passes the vertebral artery, and this belongs to the cervical region. Again, one more, the bifid spine is there. The thoracic vertebra, because in the thorax the ribs articulate with the vertebra, so very impactful feature on the thoracic vertebra is that these thoracic vertebra having costal facet on the transverse process, the costal facet, articulating costal facet on the transverse process, the costal facet on the articulating costal, and even on the body of the vertebra. When we talk about the lumbar vertebra, these are heavy individual vertebra. I'm further repeating, the individual vertebra are 3: cervical, thoracic, and the lumbar. Rest 5 fuse as a sacrum and 4 fuse as a coccyx. If I am talking about individual vertebra, just differentiate between the cervical, lumbar, and thoracic. This is the lumbar, heavy body, no costal facet, neither intervertebral foramen. And let's talk our other feature in upcoming lectures. What are other features? Okay, but first and foremost is we have to know about the different part of the vertebra. Vertebra is a single piece of bone. In between 2 vertebrae there is intervertebral disc, and this is making a joint, and this joint is known as secondary cartilaginous joint. This is found in the midline, and this type of joints are known as symphysis. That's pubic symphysis. Fibrous cartilage there who having an annular part and a central part. You have heard a term, the herniation of the intervertebral disc, the protrusion of the intervertebral disc when this is away from the alignment, compressing the different spinal nerves that cause the nerve root compression. Suppose there is an intervertebral disc, it is protruding backward or forward, especially when backward. This is compressing the intersegmental nerve, and that can lead to the symptom pain in this root or the course of this spinal nerve, and this type of features are known as nerve root compression. Usually occurs in the thoracic or lumbar region because these are weight bearing vertebrae. And it's not uncommon in nowadays when people are using a lot of mobile and other digital instrument, and neck is in a sustain position for a long duration. Okay, now coming toward the different feature of these vertebra. Okay, look at this vertebra. There is a ventral part. This is the ventral part. This part is the ventral part. This is the ventral part, and this is the dorsal part. Okay, this is the dorsal part. When you're talking about the ventral part, the ventral part is made up of body. Look at the body from the front. I'm holding this vertebra in an anatomical position, and this is the anterior aspect. The anterior surface of the body is convex side to side. Look at this one, convex side to side. Above to downward, almost concave or flat. Above to downward, but side to side it's convex. Okay, the posterior surface, look at the posterior surface of posterior surface of body, concave side to side and flat above to downward, so there is an anterior surface which is projecting convex, side to side convex, and a concave surface which is concave side to side. I'm not going up to downward. There is superior surface and inferior surface which are in contact of the intervertebral disc and communicating with the different ligaments. Posterior surface also having a foramen. Here is a foramen, a body, there is a foramen, and this foramen accepting the vertebral veins. You can see exactly in the mid on a posterior aspect of the body there is a foramen that belongs to the acceptance of the intervertebral veins. Okay, so this is the superior surface, inferior surface, the anterior surface and posterior surface. The body or ventral part of vertebra or body of the vertebra is having 4 surfaces. Now coming a very important aspect from the body. Look at this. From the body, the projecting part posteriorly. This part is projecting posteriorly. This part is projecting posteriorly. This part is known as pedicle. The connecting part, rest of the vertebra connecting with the help of this pedicle, both sides there is a pedicle. And not only that, from the pedicle, you look at this one, this part of vertebra which is posterior medially directed from both sides, this is known as lamina, and this pedicle and lamina forming a complete arch. Look at this one, pedicle, this one is lamina, this one is lamina, this is a pedicle, and this forming a complete arch, and posterior surface of the body, lamina and the pedicle forming a arch. This is forming a intervertebral foramen. When this intervertebral foramen communicate with each other, these are known as intervertebral. This intervertebral foramen, the spinal cord passes. In between the spinal cord with 3 meninges passes. Okay, this is the lamina, this is the pedicle, and now coming toward a very important aspect, these 2 processes. Look at these processes. These processes are known as transverse processes, usually emerging at the junction of the pedicle and lamina. The shape of these transverse processes, the size of these transverse processes varies according to the individual region of the vertebrae. Okay, so these are the transverse processes of vertebra. Look, one important feature, if the transverse process of the vertebra, look at this one, if the transverse process of the vertebra having a facet, both sides, this belongs to the thoracic region, because this articulate with the facet of the rib, posterior aspect facet of the rib. So if this transverse process having a facet, if this transverse process or lateral mass having the foramen, look at this one, foramen, that belongs to the cervical region. Individual vertebra 3 in number, and you can identify whether it's a costal facet or a lateral mass. These are transverse process. The projection of the transverse process, the facet and feature of the transverse process are different in different region, by which you can identify whether this vertebra belongs to cervical region, belongs to the thoracic region, or belongs to the lumbar region. Okay, transverse process. Now coming toward this very important structure which is projecting, and this is projecting actually much more in the region of the thorax, it is posteriorly downward directed, so that if we have another thoracic vertebra, this is posteriorly and downward directing, so that these are interlinking to each other, so that when viscera is in thoracic cage, that is not going to slip here and there. So this direction of the spine, I'm showing the vertebra from posterior aspect. The direction of the spine is posteriorly and downward directed, and these are interlinked, interconnected with each other in order to avoid the escaping and herniation of the different thoracic viscera from the thoracic cage. Okay, this is typical feature of the spine. So there are different aspect, different part, the superior surface, inferior surface, anterior surface and posterior surface of the body. Then there is a pedicle, which is a part projecting from the body and communicating the pedicle which is running backward and medially directed, and ultimately ending into the spine. A spine which is a typical part, this may be the bifid in the cervical region, that may be the downward and backward directed in the thoracic region, and it may be short and quadrilateral, a short and quadrilateral as in lumbar region. Look at this spine and look at this spine. Look at this spine. This is the vertebra of thoracic region. This is the vertebra of lumbar region, heavy body and quadrilateral spine. There is a chance of fracture of the spine, but this is short, stout and quadrilateral. Look at the spine of a typical cervical vertebra. It's a bifid spine because the neck muscles are there. Bifid spine. Look at this spine and this spine. Compare this spine with the spine. And one more, compare with the thoracic spine, which is downward backward directed, and compare with the horizontal and bifid spine belongs to the cervical vertebra. So I want to say that each region vertebra having different feature, and there are changes in each part of the vertebra. Vertebra is not a bone which doesn't have a clinical importance. Vertebra having a great clinical importance, because nowadays slipping of vertebra over each other, compression of nerve root, intervertebral disc herniation is not an uncommon phenomena, and that lead to the compression of spinal nerve. Okay, let's just talk about this lumbar vertebra. When the lumbar vertebra are placed on each other, look at this. Basically, these vertebra are placed like this, and this is the place where the typical spinal nerves are emerging, like this. Typical spinal nerve. When the intervertebral disc herniates, it compresses these nerves. So the pain is felt into the root, as usually you heard about the sciatica. When there is a lumbar lordosis is lost and the intervertebral disc compressed, usually L4, L5 and S1 is very, very susceptible. The pain radiate into the lower limb and reach even up to the foot and sole. And this phenomena is known as sciatica or nerve root compression. Initially back pain, then is radiating to the foot, and severe pain, the such pain is known as sciatica. Okay, not only that, one part we usually forget about to discuss, the facets, different facets. Vertebra are not individual, they are making a column with the help of adjustment on each other, plus forming an articulation over each other, and ligament which are interconnecting the vertebra. So let's talk about the facets. There are different facets. I told you the vertebra are articulating with the ribs in thoracic region, but first of all, whatever the vertebra, whether in cervical region, thoracic region or lumbar region, they are articulating with each other. So the superiorly there are two articulating facets. Inferiorly there are two articulating facets. So four articulating facets are there. The four articulating facets are there. Two superior articulating facets, two inferior articulating facets, almost in each vertebrae. Two individual, especially the individual vertebrae. Two superior articulating facets, two inferior articulating facets, and the direction of these articulating facets also confirms that this vertebra belongs to what region? what region? Okay, so articulating facet, whether it's a matter of the body, what is the shape of the body, what is the size of the body, as the cervical region having very little the body, the thoracic region a middle size body, and lumbar region a heavy body. I'm not talking about sacrum and coccyx again because they are fused vertebrae and single bones. Or it's a matter of the pedicle, direction of the pedicle, diverse direction cervical, horizontal direction is this one, and converging direction in the lumbar region. Or it's a direction of the lamina, or it's a transverse process if in the form of a mass and pierced by the intervertebral foramen, that's cervical. It's a club shape posteriorly directed and having a costal facet, thoracic region, if these are stout and small, and having mammillary process, that belongs to the lumbar region. These transverse process also changes in different region. And I told you spine, if spine is short and bifid, cervical. If it is downward, backward, beaked and pointed, that belongs to the thoracic region. And if it is stout and quadrilateral within the circumference, or most of part within the circumference of the vertebrae, that belongs to the lumbar vertebrae. That is the primary information regarding the vertebrae, different region vertebrae. On next turn, we will discuss the thoracic vertebra. Not all the features are found in all different part of region of vertebrae. Suppose cervical vertebra are there. Not all the all 7 cervical vertebra having not all the features. Few are typical, few are atypical. That does not having the feature of that region. Okay. So the vertebra may be divided into a typical vertebrae and atypical vertebrae. When we'll discuss different region vertebrae, we will discuss the atypical and typical all type of vertebrae in next few lecture, and that was something about the osteology of the vertebra. Thanks for the patience with hearing. Soon we are going to start the theoretical lectures regarding the thorax, and we will continue our journey of neuroanatomy with the upper level of the midbrain also. Thanks for your subscription, friends.